Hello and welcome, everyone. Thank you for joining today's presentation from the Health Connector, where we will present an overview of the Health Connector and resources available for those in need of health insurance coverage. Today's presentation is Health Insurance Options and Savings Through the Health Connector. We do have a number of participants who have signed up today, but we're going to go ahead and get started at noon as scheduled. My name is Shaitra Sanders, and I'm from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleagues Niki Conte and Melissa Montrond, who will be presenting today's information, and we are here to help answer any questions you might have. I would like to take a moment to thank elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and their video has been disabled. The presentation portion will last approximately 30 minutes. Then we'll have time for a question and answer period at the end. If you would like to ask a question at any time, please use the Q&A functionality. We will be monitoring your questions throughout. Please do not disclose any personal information or protected health information when you ask your question, as others on the call are able to possibly see what you've written. If you have a particular personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local navigator or certified application counselor. We are recording today's webinar. Following today's meeting, you'll receive an email with the presentation along with a brief survey about the information we've shared, so there's no need to take detailed notes. We'll also post a link to the survey towards the end of the hour. Please complete the survey if possible, as we'd appreciate your feedback on today's session, and your input will help us develop future presentations. So without further ado, let us go ahead and get started. Niki?
Thanks, Shaitra, and thank you everyone for joining us today. So I'm Niki Conte, and I will be starting us off with today's presentation. And as you can see here, we're going to cover a number of topics. We'll start with an overview of the Massachusetts Health Connector and an overview of the American Rescue Plan. I'll talk to you about getting coverage through the Health Connector, getting help, key takeaways, and then we'll link back to some helpful resources. And I should probably mention that I'm going to be sharing this presentation with my colleague, Melissa. So she'll be going into some specific areas, more practical steps of helping you get coverage. And she'll be giving you some guidance as we go along. So let's start with an overview of the Health Connector. So hoping that many of you who've joined this presentation already know a little bit about our organization, but for those of you where this information may be new, just want to acknowledge that the Health Connector is the state's health insurance marketplace. So we are the marketplace in Massachusetts, and we're here to offer individuals, families, small employers access to affordable health insurance coverage. So you might be thinking to yourself, okay, who are the folks that get coverage through the Health Connector? And essentially it's people who don't have access to health insurance either from a job or from a spouse or partner's job or any other source. Also want to acknowledge that a lot of people who apply through the Health Connector can qualify for help paying for the coverage. Particularly now with the American Rescue Plan, and we'll spend some time on talking about the American Rescue Plan in some upcoming slides, but particularly now a lot of people are able to get more savings through when they shop and enroll in coverage through the Health Connector. And lastly here, I want to acknowledge that people can also buy dental coverage through the Health Connector. I'm so used to talking about health insurance. I don't want to leave out that important piece of someone's, whole health coverage. So on this slide here, I just want to give you a little bit of background about Health Connector plans. So things that you can consider as you're looking or thinking about coverage, taking coverage through the Health Connector. So first and foremost, it's important to acknowledge that all the plans sold through the Health Connector meet both state and federal standards. So why is that important? It's important for Massachusetts residents since we do have an individual mandate in Massachusetts requiring that folks carry health insurance coverage. So starting from the left and kind of moving across this table, want to also acknowledge that sometimes you might hear or see qualified health plans or qualified dental plans, QHPs, QDPs. Again, just some insider speak that essentially means that all the plans, whether they're health or dental plans, are qualified health, qualified dental plans, and they do meet all state and federal requirements. Now, as a consumer, you can rest assured that you can choose from a variety of well-known plans in your area. So these are leading insurance companies in Massachusetts. Now, moving to the middle of the slide here, health plans with advanced premium tax credits. Now, this is really important, particularly as we think about savings for the monthly premiums each month. So people can qualify for tax credits that help to reduce the cost of monthly premiums. So the annual cost of your plan is not more than 8.5% of your income. This has recently changed due to the American Rescue Plan, and this is actually one of the ways in which people can now save additional dollars, more money. On the right-hand side, we talk a little bit about the Connector Care Plan, the Connector Care Program. Now, this program is unique to Massachusetts. People in lower income ranges who meet other eligibility requirements may be able to enroll in low or no cost insurance coverage. But really important to note that this is comprehensive insurance coverage, and I'll get into this in more detail as we move forward. On the left-hand side of the slide, catastrophic plans. The Health Connector does in fact offer catastrophic plans. These are available to people who are under 30 years of age or with a hardship exemption. The catastrophic plans, essentially you'll see the costs of the monthly premiums are lower. But when someone goes to get coverage, goes to utilize a service at point of service, they will be paying more at point of service. Essentially, the monthly premiums are lower, but deductibles and other costs are at higher when you use the catastrophic plans. And lastly here, dental plans. We have plans for individuals, children, families, small employers, and that includes pediatric only plans, as well as plans with lower and higher deductibles. So let's talk a little bit about the American Rescue Plan. And this was signed into law recently, so in March of this year. And as I've been saying, this makes financial help with health insurance more available to people. So a lot of people who already got help paying for insurance through the Health Connector now see even more savings. And the people who did not qualify for help before now see lower monthly premiums because of the American Rescue Plan. So let's talk a little bit more on this slide about more of the benefits of, I was about to say ARP, the acronym, but the American Rescue Plan. So first and foremost, first bullet here, people whose income may have been too high to qualify in the past may now qualify. So, this is great. And how are we doing this? How is this calculation happening? So instead of having an income limit for financial help, help is going to be based on affordability. So that essentially we can lower the monthly cost of plans so that they're available for people, so that they're not paying, if they choose a particular plan, they don't have to pay more than 8.5% of their income. They could certainly choose a different plan, but we are trying to, through the American Rescue Plan and through this change, trying to make access to health insurance coverage more affordable, more accessible to people. Important, all of these savings, all of these benefits through the American Rescue Plan can only be taken advantage of by consumers if they enroll through the state's Health Connector. Now, you might be wondering, again, everyone's situation is different. So you might be wondering right off, like, okay, how do I find out if I could qualify? Maybe you had applied before and maybe you looked, it didn't look like you were able to get any savings, any dollars off. We have a brand new tool. This Get an Estimate tool is available from our homepage at mahealthconnector.org. There's a link at the top. You can click on Get an Estimate, or you can follow this direct link, and you can just enter some very brief information about yourself, and it will help you determine, the results will show plans that are available in your area, and what those costs are and what the monthly savings could be. So a little bit later in the presentation, my colleague Melissa is going to do a demo of this brand new tool. The last bullet here is really important, particularly as we're thinking about what's been going on in our world, but in Massachusetts over the last couple of years. This year, people who got unemployment income at any point in 2021 can now access low or no cost connector care plans because of that. So even if someone wouldn't have qualified for coverage or savings in the past, if you otherwise qualify for connector care, meaning you don't have access to other coverage like employer-sponsored insurance or coverage through a spouse or partner. So if you're looking for health insurance, you had an unemployment at any point during this year, you don't still need to be collecting unemployment. You have the ability to qualify for connector care plans through the end. Now, this is again through the end of this calendar year. So for those of you who are more familiar with our application, you might be listening to this presentation after you've started this process. So I just want to tell you exactly where you would indicate that information. So when you're in the online application, there is a new question that's been added to the application. And it's literally, as you can see from this box, it says, did you receive any unemployment income in 2021? So you just need to answer yes there. And then there's a process that our team runs on the back end. And within 24 hours, your eligibility will change so that the connector care coverage eligibility is displayed. Also want to acknowledge that as part of the American Rescue Plan, there was new help available for people to pay for COBRA. So this financial help was available from April through September of this year. For some people, in the spring, when they were weighing their options, it was best to keep or enroll in COBRA. For others, it was still better to enroll in the Health Connector. So here we just want to acknowledge that with the help paying for COBRA ended in September. So for this month, and again for the rest of the months during this year, people who want to take up Health Connector coverage are able to. And that is because losing help paying for COBRA is a qualifying event that's going to let someone enroll outside of our typical open enrollment period. So on slide 10, I just want to show you some, well, on this slide, you're seeing some visuals of savings that are available through the American Rescue Plan. I won't go through all of them, but instead just look at one in particular. So let's look at the 50-year-old in Worcester. So if this person was making approximately, just over $44,000, and it turned out they were only eligible for advanced premium tax credits, before the American Rescue Plan, their monthly premium was $371.58. After the American Rescue Plan was passed, they had a new monthly premium, $269.82. So that's over $100 of monthly savings. So I know all of us, no one ever wants to turn down savings. So we have been very happy to share this information with people and be able to explain that these savings are available. I won't go through these others because, as I said, Melissa's going to go through a live demo so you can see how to use that Get an Estimate tool. But what I will say is that the availability of more advanced premium tax credits will differ based on where the consumer lives, as well as the person's age. So in some areas, some people are seeing more savings, but in general, with people who are older are seeing more savings than those who are younger, as the cost of monthly premiums are higher as we get older. So here on slide 11, I'd love to turn this over to my colleague, Melissa, and I'll wait for her to come on. Thank you, Melissa.
Thank you so much, Nikki. So what I'm going to be going over today is overview of the Health Connector. So first, I'm going to go over who can apply. So you should apply if you live in Massachusetts, are a U.S. citizen, U.S. national, or are otherwise lawfully present in the U.S., or if you don't have health insurance. You should not apply if you are enrolled in Medicare, Mass Health or Medicaid, or other public health coverage, are offered affordable comprehensive health insurance from an employer, or you are in jail. So who can enroll? So we have the special enrollment period. So anyone can continue to apply for health benefits anytime during the year, but special rules are in place for enrollment in Health Connector coverage during closed enrollment. So the Health Connector's extended open enrollment period ended on July 23rd. Certain situations may qualify individuals for a special enrollment period, which is the SEP, which gives them up to 60 days to enroll in a Health Connector health plan. Loss of other health coverage, such as loss of job-based insurance, COBRA coverage ending, or loss of Mass Health coverage are examples of why someone may qualify. In addition, the Health Connector will have a special enrollment period available in the fall for those enrolled in COBRA, but are no longer eligible for federal subsidies. If you need coverage sooner, apply right away. You may find that you qualify for Mass Health. So applying for coverage. So there are three ways that you can apply, and the first way is by going online at the mahealthconnector.org. And if you need the Spanish version, we do have that application, which is the mahealthconnector.org/ES. The second way is by phone, and the third way is with the help of a partner community organization or health center. There is one application to find out if you qualify for coverage through Health Connector, including help paying for coverage or for coverage through Mass Health, which is Medicaid. You will get letters from Health Connector and Mass Health that tell you your next steps. So what you need to apply, so you need to make sure you have your Social Security numbers for everyone applying if they have one, immigration documents for all non-US citizens who are applying if they have one, and you can learn about these documents at the link provided here, which is the immigration documents. Recent pay information if you have it, such as copies of your last 2 pay stubs, your unemployment amount, which is the monetary determination if you are collecting unemployment, information about your current income. If you don't have all the information above, please just give us a call and we'll send you a letter asking for more information if we need it. So application for individuals and families. So on this page here, it's our home page. So if you apply at mahealthconnector.org, you will see this page come up on your screen. Also, if you go to the Spanish version, the mahealthconnector.org/ES, you will see a similar page, but just in the Spanish version. So one application for Health Connector, Help Paying, and Mass Health. So basically on this page, you'll see here, start your application for health coverage. And you either want to sign in. So if you already have your login information, you would simply click on the circled sign in tab. But if you don't have an account with us, you would just go on the bottom of the page, the bottom left-hand side, and you would just simply create an account. So how do you enter income if you're unemployed? When you complete an application, you'll be asked about your current income and your estimated income for the year. So what you want to do is enter your income as it is right now, including unemployment income. Then enter your expected yearly income based on what you think you'll make over the course of the year. When entering your yearly income, you also want to consider how much you earned so far this year. Add any unemployment, including any extra dollars per week you may be receiving. And if you think you'll be returning to work later this year, include what might be earned. If your income changes later, you can always go back and update your income information so it is correct as possible. So what is very important is that you want to keep your income and application up to date. Remember to update your income if your employment changes. Keeping your income information as accurate as possible helps you make sure that you get the right amount of help paying for health and dental insurance. Have a lower risk of owing money to the IRS when you file your taxes next year. If you get advanced premium tax credit, which is the APTC, you can always adjust the amount you take by clicking on the Change Tax Credit link from the Find a Health Plan page of your application. If you adjust the slider tool to take less APTC, your monthly premium would be higher, but you might owe less to the IRS when you file your taxes. So now I am actually going to hand this back off to Nikki.
Thanks, Melissa. So folks, here I'm going to talk a little bit more about getting help paying. So I'm just going to continue on from where Melissa, what Melissa explained. So she went through, you know, who could apply. She explained what you need to get started. But here I want to kind of dig a little deeper into the two kinds of help that you can get through the Health Connector. So Melissa talked about advanced premium tax credits. I also described it at the beginning. I think we've conveyed that they lower the premium amount that you pay each month. But we want you to understand that the IRS sends those dollars or your tax credit directly to your insurance company. So you're going to pay less each month. Your bill will be less each month. Now, as Melissa explained just a moment ago, you have the ability to apply all of the tax credit or some of that tax credit to your monthly premium. So if you're in a situation where your income has been fluctuating or you know it's going to fluctuate throughout the year, perhaps you may decide that you want to reduce the tax credit that you're taking at this time so that when all of this kind of, you know, I would say comes out in the wash at tax time, you can, in fact, maybe get some dollars back instead at that point. So it's really up to you how you want to handle that. I would say generally that most people typically take all of the tax credit so that during the month, they're paying a lower monthly premium. Now, we also have the Connector Care program. So I had said before, this is unique to Massachusetts. And the way this works is that it uses federal advanced premium tax credits as well as state dollars. Those two together help reduce the premium amount that you pay each month. So that's why we're able to offer low monthly premiums, low out-of-pocket costs, and then those who are enrolled in Connector Care have no deductibles. Now, depending on the plan type that you qualify for, you can choose a plan for as low as 0 or 133. You know, these amounts do change every year. So when you can see some reference slides at the end of the presentation, but you can also get something a little bit more accurate through the Get an Estimate tool. Now, let's talk about the income guidelines to get help paying for coverage. So for the Connector Care program, someone's income needs to be at or below 300% of the federal poverty level. So something that factors into that is the household size. So for example, a household size of 3, if someone is making $65,160 or less, they could in fact qualify for the Connector Care program. Now, when it comes to advanced premium tax credits, the income limit used to be 400% of the federal poverty level. But what I want to explain here is that the American Rescue Plan took away that income limit. So we were able to implement this by May of this year. So again, instead of an income limit, people are going to qualify for advanced premium tax credits based on affordability. Now, advanced premium tax credits, as we've been saying, that is what lowers the monthly cost, so that ultimately people who qualify do not have to pay more than 8.5% of their income. So here, I'm just going to go on and talk a little bit more about choosing the right plan. So this is a process. You need to apply. Once you complete the application process, you find out what you're eligible for. Then you have to choose the right plan. You need to enroll. So the Health Connector has different tools that you can enter, where you can enter provider and medication preferences. So that gives you an opportunity to not only look at plans, but you can also see pricing. Now, before someone applies, if you want to look to know what the options are, just based on your provider and medication preferences, you can use this plan comparison tool. And then, as I mentioned, we do have this new Get an Estimate tool, and that's where you can find pricing from leading Massachusetts carriers, and you get to see your savings. Now, when you're in our application, you're in our system, you have the ability, when you're in the application, to use some of these shopping tools as well. So you can filter by your preferred providers and facilities, as well as your preferred medications. And then after you do that, so in this example, I put in a couple of preferences for 2 physicians in 1 facility. So whatever it is that you put in as preferences, when you get to the Find a Health Plan page, you'll be able to filter and sort your results based on that information. And then, since we are in the online application, I just want to acknowledge that if you are required to make a payment, all payments are due on the 23rd of the month before someone's enrollment is considered complete. So you can submit your online payment by clicking Make a Payment on the My Enrollments page. Now here, I'm going to pass this back over to Melissa just to talk a little bit more about customer service as well as our community partners.
Great, thank you so much, Nikki. So I just wanted to go over where you can get help enrolling in your health insurance coverage. So we do offer free enrollment assistance through the Health Connector customer service and across Massachusetts through community partner organizations. So our customer service number is 877-MA enroll, and that number is 877-623-6765. And we also have a TTY number, which is 877-623-7773. And that number is for people who are deaf, hard of hearing, or speech disabled. Also, for information about hours, days of operation, and more, you can go to the Health Connector Customer Service Call Center, and you can click on that link for more information. Also, we have community partners, which are trained and certified navigators and certified application counselors who speak many languages, can help you from application through enrollment into health insurance plans. They can answer questions about eligibility, the application, payments, plan details, and healthcare reform rules and requirements. It is recommended that you call ahead to schedule an appointment for help. And to find help in your language, you can also go on the link, Get free help near you. So I am going to switch this back to Niki.
Thanks, Melissa, and thanks everybody for hanging with us through the presentation portion. So here, I just want to go over a couple of reminders and details about shopping and enrollment. So what we want you to go away with is knowing that people whose income may have been too high to qualify in the past may now be eligible for more savings through the Health Connector because of the American Rescue Plan. So we're very excited about that, and we're almost ready for Melissa to do her demo. So that's great. Also want to acknowledge that anybody who received unemployment income this year can also get some additional help. They'll be eligible for the Connector Care Program, Connector Care plans. And again, that continues on through the end of this calendar year. Not knowing exactly who's on this webinar, just want to remind everybody that if you lose employer coverage, that's considered a qualifying life event, and that gives you a special enrollment period for enrolling through the Health Connector. Really, if you are in this situation and your coverage is ending, we just want to encourage you to apply and compare your options within 60 days of losing your employer coverage. And know that, as Melissa said, you have the ability to apply online for coverage, over the phone, or with the help of an assister. So again, local community support. Now, the last bullet here, it says some people are going to get an automatic special enrollment period to shop. All we really want to say here is if you go through this process, you need coverage, and for some reason you get stuck, you can't shop for a health plan, we encourage you to call Health Connector customer service for help, and they can get you over the finish line. Also, of course, you can contact a local navigator. Navigators are grant recipients from the state's Health Connector, so they're wonderful organizations. I was about to say sprinkle, but there are organizations across Massachusetts that can help you with this process. One of the great things about navigators as well as customer service is that if you had started the process yourself and then for whatever reason got stuck, or you didn't complete the application, you didn't get to the end, if you give the customer service rep or a navigator permission, they can pick up wherever you left off and they will get you across that finish line. Now, a couple of other things here before I hand this back over to Melissa. Just deadlines to be aware of. If you're looking for coverage that starts November 1st, you need to apply, enroll, and pay your first premium by the 23rd of the month so that your coverage can be effective on the 1st. So for example, pay by October 23rd for November 1 start date. Technically, if there's anyone on this webinar who's planning ahead, you also have the ability to choose coverage that starts on the 2nd month after you become eligible, again, for people who are planning ahead. As I mentioned before, free help, I can't stress it enough. There is free help available for this process. So don't worry at all. If you want some assistance, especially during this public health emergency, we encourage you to call to make an appointment to schedule that help. So Melissa and I are here to help answer questions. I saw a number of things going across the screen.
So we do have some questions. Hopefully you guys can provide some answers to our attendees. There was a question about qualifying for premium tax credits. The person would like to know what income should be entered into the application when looking to apply for the premium tax credits. Can you, either Niki or Melissa, talk a little bit about what types of income someone should include in the application and how to get help entering these if they have any questions?
Sure. So I'll start, and then Melissa, if you want to give any more like practical guidance, I think that would be appreciated. And then I think we have some people on the back end who might be able to paste some links to the income, more detail from our website. But basically, you'd want to include the income for anyone who's part of your tax filing household. So I'll keep this example very simple. So let's just say it's you and your spouse, you're applying for coverage, both of you need health insurance coverage. You would be a household of 2, and we would want to know about any income that any taxable income the 2 of you earned or intend to earn for the year. So one of the things Melissa alluded to was that when you have to answer questions about income, you're asked about your current income as well as your projected income. So current is whatever's being made in your household right now. Projected is what you anticipate will be made for the whole year. I know we always get the question about, is this gross income? What is this? So the Health Connector looks at modified adjusted gross income. Now, we don't expect people to figure out Magi on their own. We just expect people to, enter the information that they know, and the system will do the modified adjusted gross income calculation. So Melissa, is there anything like more practical? Because I know I kind of went in a couple of directions.
No, that's perfect. I just want to mention as well, the application's pretty straightforward, and it has sections where you would actually, if you get paid bi-weekly or weekly, you can enter that in, and then the system pretty much calculates your yearly, income, and then you just check off whether or not you agree with that income. And if not, you can also add, have an estimated guess to what you earn for the year and put that in that section there. So there are sections that you work through. But again, if there's any questions regarding that, we are here to help you.
All right. So let's put together possibly a scenario. Say, for instance, someone's health insurance is going to end through their employer around November 14th. When should that person go ahead and apply through the Health Connector for themselves and their dependents?
Okay, so I know we have some policy people in the back end who will keep us honest in case. But if you have a projected date that you are going to be losing coverage, you can apply for coverage up to 60 days before and no more than 60 days after. Is that right, Kayla? So 60 is the key number, 60 is the magic number.
Yep, and if people have questions about when they might want to start that coverage, even though their current coverage hasn't ended yet, they can find help through those different ways we've mentioned, and you'll be sending out the slides so people have those links, and there's lots of different ways people can get help and sort of think through when it makes sense to start their coverage for their own specific situation.
Thank you. So the next question, actually, I can answer. It's what are the options for small businesses and their employees through the Health Connector? So We have a whole other platform through the Health Connector called Health Connector for Business that is available for small businesses here in Massachusetts, those who have 1 to 50 full-time equivalent employees, that you can certainly go on and offer your employees employer-sponsored coverage. The exclusive benefits through the Health Connector for Business allows for employers to control their costs while providing their employees with the option to choose the best insurance that fits their needs. If you'd like to learn more about the Health Connector for Business, you can also go to mahealthconnector.org/business and view some options there. You can also call the customer service center at 888-813-9220. And we also have free certified broker assistance listed under the local help tool that Melissa and Nikki mentioned earlier. There's one side that is for the individuals, which will show assisters and navigators. And then there's another tab that will show access to brokers. So please feel free to also go to the site mahealthconnector.org/business and see the options that are available for small businesses. That made me so happy to be able to answer that. So we do have some more questions. Give me a second as I'm reading through them. We had a lot come through. Ladies, when does open enrollment start?
Sure. So regular open enrollment for coverage that begins January 1 of 2022 starts November 1st. So basically what that means is beginning November 1, you'll be able to come to our website. You'll be able to apply for coverage for January 1. You'll be able to see the full pricing for next year. But also anyone who is already a member with us, and let's say for whatever reason they wanted to change plans for the upcoming year, that's the time frame. So between November 1 and December 23rd, you have the ability to either existing members have the ability to change or make updates to their application, change plans. New members or people seeking coverage can get coverage for the upcoming year, and that all begins November 1.
Great. We have an unemployment question. So if you had unemployment in 2021 and you've joined, and have Health Connector insurance, but now you have a job, so you're employed, and your employer goes ahead and offers you employer-sponsored coverage, but you feel the cost is too high, what are your options?
So I'll start, and then Kayla, if you want to jump in, I'd appreciate it. Thanks. So I would suggest that if you are, you had gotten your cover, if someone had gotten their coverage through the Health Connector prior to being offered the ESI, I would suggest you come into the system, update your application, and then I would enter the employer, enter the pricing of that plan. I'm not sure if the words are coming out the right way of my mouth. I apologize. So that's where Kayla will help. But basically, you want to get some information from your employer about the individual only plan, because that's the plan that the system uses. Those are the dollars, those are the costs that it uses to determine if the plan is affordable using state standards. Kayla, please say that in an easier to understand way.
No, that's great. I would just add, that's right. The affordability standards are unfortunately not something that we create. It's a federal calculation. So what might seem unaffordable to somebody, to you and I, that's a calculation by the federal government. Our application does that. And so even if your plan seems unaffordable, it might be considered affordable, and that would block you from help paying for coverage through us, because you have that offer of affordable employer-sponsored coverage. So that is sort of just a set calculation. It's not really a choice, so that would just put that barrier up from getting the help if you have that affordable employer coverage.
Okay. How long will the American Rescue Plan changes last?
Okay, so there are different aspects of the American Rescue Plan that have different time frames associated with them. So when you get these slides, you'll have this information, but basically like the COBRA subsidies, that was a short time frame. That was April through September. So those are no longer available. Right now, the additional dollars, the advanced premium tax credits, the extra APTCs that are available, they were for 2021 as well as coverage year 2022. The benefit for those on unemployment, that ends through the end, excuse me, that continues through the end of this calendar year. Have I missed anything, Melissa or Kayla?
I think that's everything that I can think of. Thank you.
Yeah, sorry about there are on different timelines.
So a person who has an adult child under 26, they'd like to add that adult child to their coverage, but the adult child does not live with them. The estimator would not allow them to add that adult child. Will the application allow it?
So I'm going to, I'm sorry, I think I missed the first part of this. But I may need Melissa's help on this. So if someone has an adult child and they're a dependent.
Under 26, so they're adults,
under 26, yep.
Not living with them, but the parents would like to add them to their coverage. The estimator did not allow this. Will the application allow it?
Yes, it will. So basically, as long as we're thinking about your tax filing household, as long as this person is a true dependent, yes, you can include that person within your application.
Thank you.
Yep.
And I think you already answered this question, but I'll ask it again just in case. The income that's entered, is it net or gross?
It's gross income.
Okay.
What the system does is it does some other calculations. So ultimately it's modified adjusted gross income when it's all said and done.
And you guys spoke about that earlier, right?
Yep. Yep.
So here's kind of an question that, I think we can lead this person in the right direction. If someone does not qualify for any state or federal help, such as the advanced premium tax credits, paying for coverage, is it better to apply directly to the insurance company? Or actually, what are the benefits of Health Connector coverage if they do not qualify for help?
Sure. So I think there are a couple of things. I think if someone doesn't qualify for any savings and they're just wondering, okay, what are the advantages of shopping through the marketplace? I think there are a couple that come to my mind, and then others can certainly add in. One thing first is the fact that that everything sold through us meets state and federal standards. So again, living in Massachusetts at tax time, you're going to be asked about your coverage. You know that anything that you purchase through us is going to be comprehensive coverage. The next reason I think of as why it would be important to shop for coverage through us is that you are seeing side-by-side comparisons, or you can see side-by-side comparisons of plans from different health insurance carriers. So that's another advantage of coming to us. So again, you get to shop for exactly the plan that you want or that's going to be best for you. We know from past research that some people, sometimes people shop name recognition, but maybe, if they're just shopping by preferences, they could go with a carrier or go with a carrier in a network that's more limited, so smaller, and they can save some significant dollars each month. So I think those are the reasons that come to my mind. I don't know, Melissa or Kayla, in your experiences, is there any other, I'm just trying to think from a consumer perspective, is there anything else we'd want to acknowledge about, shopping through the marketplace? And people can, of course, go directly to carrier. We don't want to, if somebody just wants to use our site to gather the information, that is okay too. We are a state resource, so certainly people can use that resource in that way.
Yeah, I totally agree with all of that. The only addition I would say, maybe another benefit could be if your income changes suddenly, you'd be able to just go into the application, update your income. You might end up being eligible for subsidies if you weren't before. So that's one benefit. But yeah, I think the biggest take home here is it's sort of an apples to apples comparison. You can see everything in one place and make that choice comparing across different companies.
And I know the time is cutting close right now, so I don't want to ignore anybody's questions. We have gotten several Medicare questions, and I know we didn't really touch upon that. Niki, could you provide us with where those individuals should seek information about their Medicare questions?
Sure. So the state has really great resources known as Shine counselors. And I want to rattle off a number, and I don't want to make a mistake. So what I will say this, and then I'll give a chance for my colleagues to maybe post the link in the Q&A. But basically, if somebody goes to mass.gov and they search for Shine, and Shine stands for Serving the Health Insurance Needs of Everyone. And Shine counselors really can help people with Medicare enrollment, and they're also very skilled at helping people who might be transitioning from Health Connector to Medicare, or who might be in a situation where they're combining Mass Health and Medicare. So health insurance is very nuanced. We can certainly only speak to Health Connector coverage, and we have other colleagues who are more skilled at speaking about Mass Health or Medicare.
And we are closing up on the hour, so I don't want to take up anyone else's time. We did have several other questions coming in, but Niki, can you just let us know again, if people still had questions and they want to get those questions answered, where should they seek that assistance from?
Sure. So we will be sending a follow-up email. So if there is anything that we can answer, we'll certainly respond back to folks. Also, if somebody wants to get help to a particular personal situation, again, we all suggest that you would contact a navigator. Navigators can help you one-on-one. So we just recommend that you contact a navigator, make an appointment with them, that you don't need to see them in person. You can do virtual appointments with these folks, and they can get into any any particular details that you want to. I would say navigators are the best bet to handle kind of like a detailed or more complex scenario with someone. They're here to help, and that's what they do.
Great. Well, Niki, Melissa, great presentation. Kayla, thank you for your help with all of the questions and coming in for some of these policy related items. I think it was very well informed, and I hope that the attendees are going away with some great information, and that they'll be able to get their follow-up through the navigators or our customer service center. Thank you all for joining our webinar today. As Niki said, this will be sent out to all of you, so feel free to utilize the video that we'll upload later or the PowerPoint. And from everyone here at the Health Connector, be safe and well.